Welcome to Breaking the Couch, a weekly conversation demystifying what happens in and behind the therapy scene to support your healing journey. We are your hosts.
I'm Dr. Doughton, a licensed clinical professional counselor, a certified school psychologist, and a trauma specialist with Playfully Psyched.
And I'm Dr. Joharchi with Soft Heart Psychology, a licensed clinical psychologist.
We're here aiming to provide you with mental health tools to address the cycle of generational trauma across the age span, from infancy and childhood to adulthood.
For more information, visit our Instagram page at Breaking the Couch or our website, breakingthecouch.com. While we hope you love listening to and learning from our podcast, it's not a substitute for a relationship with a licensed mental health professional. Welcome back, folks. Hey, Dr. Doughton.
Hey, Dr. Joharchi.
I'm kind of interested to see where our topic goes today because I want to talk about what happens when I goof up, what happens when there's a rupture, right? So I guess it's not just me goofing up, it could just be like a misunderstanding. And these kind of things happen all the time. These happen in the grocery store line. There's ruptures with friends, with loved ones, all the time there are ruptures. But in therapy, it's a little different because I think that we have, I don't know, I remember one time one of our professors,
Dr. Bryce.
Yeah, how'd you know that's where I was going?
I quote that him all the time. I've told you this quote a million times. Ruptures and repairs is where I got this. I learned this key thing from him. So feel free to share with our audience.
That's right. Yes, exactly. So he used to tell us, right? Like he used to say something like, and correct me if I'm going astray, but he used to say something like, there is actually no mistake in therapy. And so I would, back
As long
then,
as
like,
they come back.
oh, okay. Well, I
Right?
forgot about that part, but that makes sense.
Basically, right. As long as you can repair any rupture as long as they come back, right?
But that's right. Yeah,
Mhm.
because if they don't come back, then we can't, there's no, yeah.
Yeah.
So I love that because I would be like, oh my gosh, I did this thing, right?
Mhm.
And then with that empowerment and that encouragement, I could say, hey, I did this thing to the
Mhm.
client again if they come back.
Mhm.
So if and when they would come back, I could say, hey, for example, it was my fault that, I did this scheduling thing, or I take responsibility for going too far, too fast with this trauma recovery work, which is exactly what happened a couple of weeks ago. And you and I met
Mhm.
for trauma consultation, and you kind of helped me like, hey, remember, we claim responsibility when that happens. And the client trusted me enough to say, this is what happened, instead of disappearing or um, internalizing it because it had
Mhm.
nothing to do with them. And I want to be the one to own that and say, okay, wow, like I totally love that you came to me and said this. This is a total reflection of the work that we've done to develop that trust. And moving forward, I'll make sure that there are so many like grounding things and nervous system relaxation things that we can do together that make
Mhm.
sure that when you leave, you feel like really, yeah, maybe a little triggered by some of the content that we worked on, but super safe and sort of cocooned in whatever grounding strategies we used for you to leave.
Mhm. Mhm. Yeah, absolutely. What I liked about that is that the patient came to you and told you, "Hey, this didn't
Mhm.
work for me," or "This was hard." And I wanna acknowledge how hard that is for so many people, right? And I was just telling you that on one of my social media feeds on my TikTok, right? Something that's been coming up is people saying that they just ghost their therapist, right? Even if things were going well for a while, as soon as something's not working or not feeling right, it's so overwhelming for them to say, like, to give feedback to their therapist. They feel like they're being
Mhm.
critical, and they understand that the therapist is just trying to do a job, but they're not enjoying the therapy, or they feel like something needs to change. And instead of saying that, instead of trying to work to repair that rupture, they leave. They just don't return calls, don't come back to text, ignore reminder appointments, right? And they just don't go. And I actually saw one person post that they stopped going to therapy altogether,
Mm.
and they don't want to go back because of that piece. Like they don't know
Mhm.
how to talk with therapist about like, hey, this isn't working. And so I want to acknowledge how hard that is, and also just for people to know that it is part of our responsibility as therapists to check in, right? I don't want that to be
Mhm.
the burden of patients to only be like, I have to give feedback. It should be solicited from you. You know, we should have routine times where we're checking in. I know I try to do that and in most sessions, but especially sessions where I feel like I'm picking up on facial expression or something that is like, oh, okay, all right, let me know how things are going, what's working, what's not working, you know, maybe I said something that was really offensive, or let's kind of talk about this. Let's see if we can repair this. And there are those instances like you talked about where session ends and you think things are fine, and then you realize through they come back and tell you, or I think the first time it happened to me, a patient had a really long extended like anxiety attack almost right after session.
Mhm.
And so it was messaging me and like, I can't regulate, like their like partner was like, maybe you should like call back your therapist in an emergency, something, because this doesn't feel like it's
Mhm.
right. Right. And we didn't do, I thought that I did enough grounding, but it was clear that I had not. Um, and I also had not cushioned enough to understand, because this is their first time doing trauma work, cushion them enough to understand what it looks like after, before, during, and after a trauma session. Right. And so I do a lot of psychoeducation in the beginning to try to prevent that rupture. But when it happens, it's my responsibility to initiate that. And I think, how do you feel about, our own defenses, because it's hard receiving feedback. It's
Mhm.
hard when you didn't notice that something was going wrong and they bring it to you. How do you navigate that?
Well, there's a couple layers there, right?
Mhm.
So I have to say, for the most part, I really love working with the people I work with. So even if they are like, hey, this caused me a panic attack,
Mhm.
even like my most offensive side, genuinely, for the most part, just feels like a little bit like, oh gosh, I really want to repair this. Like I guess I would say a little bit of tenderness,
Mm.
if that's the right word, right? So
Mhm.
I don't feel super like, well, I told you the risks and benefits, like we've all been to that doctor, right? Like where
I
we
know,
go
I've not
in
been to that doctor, but
and they're like,
sure they
okay,
exist.
well, I'll just say, right? So I know someone who went to the doctor recently, went to get something removed from their foot. It got infected because of the way that the doctor did it, right? I'm not trying to
Mhm.
scare anyone from the doctor, from us therapists,
A
but
physician, yeah.
yes, and the doctor was super nonchalant. Like, well, that's the risks and benefits. So that's not what is going to come up for us, at least, you know, you and I know that for sure.
Mhm.
But I do feel like a tenderness in my heart. I feel like, oh, okay, they were left out there feeling like that. What can I do to repair this and to make sure to do that beautiful grounding stuff that you were just talking about, right?
Mhm.
Um,
S
oh, go ahead.
No.
Mhm.
No, so so
And
so you so what I'm hearing is, like, which is amazing, that you don't feel defensive, that you just feel, um you go right to the helping point. For me, I'm gonna be open and honest, right? It depends on what the situation was. I definitely feel hurt, like, oh man, my little Dr. Down, my
mhm,
younger self, feels like the failure in that point, like, oh, I screwed up, right? So have all those feelings, and because I have those feelings, I am fighting off um the whatever, depends on the situation. But in so I think when it's something that, I don't know, I've had experiences where there may be something I felt like I did do a good job, or we did talk a lot about grounding. We left it grounding.
mhm,
And I've had some people say, I had one or two people say, okay, well, I don't need to ground at the end of sessions, right? And then come back several sessions later and tell me that I wasn't doing a good job. at something. And I'm like, okay. So it's hard to be, for me, that was like hard to like just hear, take that in and listen, like we can be doing other things, but it's also like, okay, but are you grounding? Like I wanted to ask that and like not sound, but like, okay, we don't do it in session. So do you try any of the things? Do you, maybe it doesn't work for you? Are there different ones we can try? Like trying to not like couch that in a defensiveness, because my thought is like, my honest human thought is, well, maybe if we tried these things and just to see if it worked, then we could say, okay, it doesn't work and I screwed up. So some of those things come up for me too. That makes sense.
That does make sense, and thank you for that honesty. I could dive a little deeper, definitely. I feel like that initial tenderness, and I think it's that part of me that really wants, like, hey, you're showing up as your best self. You're doing this hard work. I so deeply, like, in that genuine moment, want to um show up as my best self too. And I didn't want them to have an adverse reaction or, a panic attack or whatever. With that being said, there's also a part of me that sometimes does think, well, yeah, the same thing that you said, like, okay, well, this also tells me that we need to look into like disassociation more. We need to look into what you're doing and the way that you're doing it, not in a investigative way, but in a way of like, how can we inventory? If you say you're doing mindfulness, what does that look
What
like
does
for
that look
you?
like? Yeah, exactly.
Right. And so if you say you're meditating, what does that look like? What do your deep breaths look like? And so
Mhm.
just slowing the whole process of therapy down a little bit to check in. Because sometimes I think the defensive part of me or the ego part of me, if I'm really labeling it the correct way, wants to like push forward. I'm like, okay, you have this ouch point, you have this pain, you came here to work on it, like let's do it. And then in doing that, I might skip the part where the doctor rubs the foot with alcohol to clear the wound first,
Mhm.
right?
Mhm.
And in doing that, we can cause an infection. So
Mhm.
a lot of times I think my thing is like, oh, I'm kind of like, I need to slow down, check
Mhm.
in, see what the things that they say they do look like for them,
Mhm.
maybe add to that, right? Like for me personally, I love to do a lot of physical grounding.
Mhm.
Maybe if I met with somebody, they would tell me you could incorporate this other stuff, right? Like there's all these other types. Like maybe I do really calming strategies and somebody wants me to do some alerting strategy or alerting strategies, something to wake me up a little bit.
Mhm. Grab that
Um
ice cube. That's it. Yeah, yeah.
yeah, yeah, some citrus, some ice cubes, exactly.
Mhm.
Um, so I feel like that. And then there's another part of me that I didn't think of until right now that really thinks about, I appreciate your appreciation for the client stepping up because I think a lot about the power dynamic. I tend to work with folks who are BIPOC, who are LGBTQ, and, with my layers of privilege being white, being cis, right? Or white and Iranian, but, like white passing privilege for sure. So if I'm sitting there with somebody who, let's say, is thinking, wait, if I tell this therapist what happened, that I had, for example, a panic attack after session, will
Mhm.
she get in the way of my electrolysis? Will she get in the way of this life-saving, medical necessary treatment that I need to
Mhm.
progress in my life?
Mhm.
And no, I won't, of course not. But there's also that like thing. And so I think that with all my tenderness in my heart that, oh man, I missed the mark here. I also want to be really mindful of any sort of power dynamic there where it might have been super, super hard for them to tell
Exactly.
me.
Exactly.
Yeah.
Yeah. It's always super hard because even if we're not looking
Mhm.
at, in cases where you're the same race, you're the same everything, right? Gender identity, all those things, there's always an embedded power dynamic within therapy for many populations or from a cultural perspective, because you're the doctor, right?
Mhm.
And they're the patient.
Mhm.
And so while we look at it, you and I and a lot of therapists might look at, okay, well, we're together, like we're walking side by side, and
Right, right.
we're like we're on the path with
Absolutely.
them, right? But many people look at it as a, you know, you are the expert helping me through this medically necessary intervention, which is therapy, right? Um, how do I talk back to, and it's the same thing, right? Where you look at medicine, where you look at mental health, people are like, well, how do I tell my doctor, how do I tell my physician, how do I tell my therapist, my doctor, that this isn't working or this isn't helping? Like that's the part that is so hard. So that's um try to remember that and the tenderness as you're talking about,
Mhm.
so that if I do have some of those other defenses, that they aren't what's going to show up. I'm human. I think we're all human. So there may have been times where it did show up, but my goal is to not beat myself up, to do what I'm asking people to try to do in their
Mm.
sessions, right? To use it as a
Mhm.
learning opportunity, like you said, to, okay, we should need to step back. Let's look at this. Um, I also am always trying to think about, I've had times where I felt that there was a rupture because I'm like stewing over it for a while, like, oh, I said this, I don't think they took that well, whatever. And so then I come back to the next session, just want to say, hey, I just want to bring this up, right? Because I don't want it to be something that festers in the therapeutic alliance relationship. And I don't want it to be something that they have to bring up, because I do understand that that can be super hard. And I want to be transparent that I want us to be able to work through things, right? When things don't feel like, and sometimes people are like, what are you talking about? Then it's like, oh, I was in my head too much. Like, I didn't like that. Like, I don't even remember what you're talking about, or, okay, thank you, or whatever. Like, okay, doc, like,
Mm.
I really appreciate you saying that, but I also did not notice that that was an issue or anything like that. So there's been those cases. And then there have been people who've been like, no, I really appreciate you bringing that up because it was hard for me to say. So in the words of Dr. Patrick J. Bryce, right, any rupture can be repaired as long as the patient comes
Mm.
back. Right?
That's right, that's right. And as you're saying that, that's making me think about, like, some of the things are so funny when I'll think that, okay, so there's no rupture that caused the risk side of therapy, the adverse reactions that we're talking about.
Mhm.
But I just want to name that I realize, I've made a lot of changes in my practice within the last couple of years, right? So
Mhm.
I'll name that and I'll say, I realize you've come with me to this office and now gone virtual and done this and done that. And they're kind of like, okay, Dr. Joharchi, let's move on. I want to talk about the stuff I mentioned. And I'm like, oh, okay, let me get back in the moment and get to whatever you had to work on today.
Mhm.
So I think that's kind of funny. I like to just kind of I kind of honestly just laugh and go with them on that. So
The
yeah.
times where it sounds like it's funny, the times where we are, because we are trying to be so mindful of ruptures and repairs, where we're like over repairing things that they were like, okay, that's nice. Thank you for acknowledging that. Now let's move on. And we're like, oh,
Yeah.
okay. Like, um, but I think that's really helpful for people to know, because therapists bring themselves into the room
Mhm.
too, right? And that's kind of what we're showing here right now, is that we think about our patients in between sessions. They're on our minds because we
Mhm.
want to help. We want to care for them. We want to, want them to be fulfilled and empowered in their lives. And we take our role in that journey really seriously. And we're not perfect,
That's
right?
right.
We make mistakes. We create ruptures, and unintentionally, but impact is more important than intent. So
Mm.
often.
Yeah.
Yeah. Yeah.
And something you won't hear me say when there's a rupture or a perceived rupture is that there wasn't. So let's say a client tells me, I really see that you've created a, a pile of crap here, right? Like you've really messed up or whatever. Like this
Mhm.
rarely happens. Like I said, like those all happen every couple of years. For the most part, I'm just really appreciative of the fit that I have with the clients that I see. But when that does happen, because we are all human, and if there is a mismatch or if there's a thing between us, right? An energetic thing, or there's a thing where they saw me as their abuser or their mom or whoever, right? Which is totally understandable. This is therapy,
Mhm.
right? I'm not going to gaslight them and say they didn't see
I was
what they
just
saw.
gonna say, like, you're not gaslighting your
No.
patients?
No, right.
Thank
So even
goodness.
if I don't get it or I don't see it in that moment, I have consultation, meaning I can take it to someone else. So
Mhm.
maybe it was or wasn't. Either way, I'm gonna hear them out.
Mhm.
I'm not gonna
Mhm.
crush their experience. That
Mhm.
would make you need more therapy. And I just wanna say there's a couple folks who have been coming to me lately where they've had those experiences, and that makes me mad. That makes me
Yeah.
really mad. Like, wait, you've done the hard work to finally access therapy, which is like, why is it hard work? But this
But it
is
is. Mhm.
yes, this is
Mhm.
the United States. So it is. So they've done that work. And then they find this person that, or multiple providers, Dr. Doughton, multiple
Mhm.
providers within one person's life experience. And that person tells me, like, hey, these are the ways that therapists have crushed what I'm saying. And I'm just like, that's really a disappointment to me.
Mhm. Mhm.
So even if I don't get what the person's saying, even if I don't understand the rupture that they're bringing to my attention, I will hear them out and kind of like put it in my back pocket, put it in the back of my mind, bringing it to someone who I can really dig into it with, whether that's
Mhm.
my own therapist, whether that's my own consultation group, so that I can see, is there something that I didn't see there? Or is that a projection that we can further process or kind of go into that? But I like that we don't sort of put that away and pretend like, oh, I didn't like what you put on me, so it's wrong.
Mhm. Mhm. I wanna add to that just by saying, and how amazing is it that if they've had even if they'd only had one, but if they've had multiple therapists where they felt wronged them and they're trying again,
That's right.
right?
Yeah.
Like that
Mhm.
there's something there that tells us, right, how much they want to feel better, how much they want to grow in their life, whatever whatever they're coming to us with. But that's an amazing piece in and of itself, that you have been harmed by a field, right? You feel that you've been harmed by a field several times and you're still willing to try again, right? Because you realize that there's value in the work that they can provide. I think that's super powerful. And I love that you're not gaslighting patients. Like, please don't do that. Um, please don't do that, therapist listening. Don't gaslight patients. Yeah, yeah. I hope I don't gaslight patients either. Um, yeah, it's not my goal. Yeah, when they come to me with something, I just want to listen um and do better. You know, that's because I think their perception of it matters regardless of if they're feeling hurt. Then that's we go into. I always tell people in sessions, we go where you need us to go, right? And so sometimes that means processing a hurt that I caused, right? Um,
Mhm.
so yeah. Wow, what a talk. What
I
a
know, absolutely. I feel like I could keep going, but um, yeah, as always, if folks want more, just let us know. We can have a part 2, part 3. What are our folks wanna know, like, specific stuff
Mhm,
of what I've said or done, and how we've used it as, like, a way to kinda heal or even lead back to some other times where this has happened and they haven't gotten a chance to talk about, like, the repair and the repair of that rupture, which I don't know if we even talked about what a rupture is.
mm,
Like a break, right? Like a wound, right? So
a wound, injury in the therapy
mhm.
relationship, right? I mean, ruptures, and you kinda talked about it in the very beginning, you did say, like, it can happen
Okay.
throughout not like that, but that it can happen in other types of relationships. Like, we always have ruptures. When you get mad at someone or someone hurts your feelings, that's a slight rupture in their relationship, right? So it could be your
Yes.
friend, it could be a child, it could
Mhm.
be your boss, it could be your therapist, or it could be anybody
Yes.
that you're in relationship with, and there's some type of relationship injury. So your feelings are hurt, their feelings are hurt, and you guys have to figure out to come together to resolve that conflict or to resolve that wound, to repair that injury. And often in a lot of relationships outside of our life, we actually don't. I think that's a key point we missed here. In a lot of relationships outside of therapy, on their own, people don't repair ruptures.
Oh,
They move
right.
past
Yeah.
them. It's something swept under the rug. We never talked about it. We never addressed it. We moved on. But the
Yes.
problem is, right, what happens to untreated wounds? Untreated, scars or injuries on your skin, what happens to they scar over, right? And what
Mhm.
happens if you keep cutting that same spot, or that same spot keeps getting injured, the scar gets bigger and bigger and bigger. It can cause problems, right? Then we have infections, all sorts of things, right? And
And then we
worst
pass it to others and yeah.
exactly.
Mhm.
And worst case scenario, we have complete severing, right, of body parts, limbs,
Mhm.
skin resection, all sorts of things. And so, what therapy can help you do when you come back is it can help you learn how to repair ruptures within relationships, right? Because it's super hard to do. And that's usually why people want to sweep you under the rug, right? Or like just not talk about it, move on. But therapy can be a place where you like, okay, this was hard and we worked through it. And this is what it can look like when someone doesn't gaslight me, when they just listen, when they
Mhm.
let me, we can talk openly about that. And it's still going to be a little bit unique because even though it's a relationship, it's a little more one-sided. We are there to support the patient and not they're not there to support us and meet our ego needs and all that stuff. But it's still a little bit of a model to how you can repair relation ruptures throughout other relationships in your life. So yeah.
Absolutely. Yeah, I really like that point. This isn't something that we do. I honestly haven't done this for a majority of my life until maybe the last 5, 10 years did I start actually bringing some of this into my everyday life. So,
Mhm.
yeah, I have a lot of that scar tissue from unaddressed wounds. And I'm really grateful when people are able to say, hey, like, I don't know what this is, but this is what happened.
Mhm.
Or however they wanna bring it up.
Mhm. Mhm.
Sometimes it might not be that easy in person. If they needed to just let us know in some other kinda way, that's okay too. Um,
That's true.
mhm,
That is true. That's another thing that I think that listeners could benefit from knowing is that you can talk with your therapist maybe in the beginning, maybe in the first session as you're getting to know people, but if you haven't, it's still okay to kind of like what are the methods of communication you can use to
mhm,
express, hey, I need to change something in our relationship or change how my treatment is going. Um, because maybe therapists will be like, hey, leave a long voicemail. Hey, send a message. Hey,
mhm,
put it in your journal and let's look at your journal. Hey,
mhm.
tell me in session. Like maybe there's some options that, like you said, maybe um, you don't have to do face to face if that's really what's struggling. Especially in the beginning, the first time we've said something about it, there can be options for you for sure.
Right. That's
Yeah.
right. Yeah, so just let us know if you want, to hear more or, to get some of the specifics.
Yep, there should be links to call in for voicemails, and you can email us and visit our Instagram page, all those things to like leave comments and let us know um, how we can answer those questions for you.
Yeah, so bye for now, and we'll see you next time with Breaking the Couch.
Yep. See you next time.
If you are looking for a therapist for yourself or your child, you can visit our websites, playfullypsych.com or softheartpsychology.com.
We appreciate you joining us this week and can't wait till there's another opportunity to jump on the couch with you next week.